Mental health awareness aims to option A stigmatize patients, option B educate and reduce stigma, encourage isolation, option D promote myths. The correct answer is educate and reduce stigma. Mental health awareness spread knowledge and reduces negative belief about mental illness. According to WHO, health includes option A only physical well-being, option B physical, mental, social well-being, option C only absence of disease, option D spiritual well-being. The correct answer is option B physical, mental and social well-being. Who defines health as a complete state of physical, mental and social wellness? Next question. A person unable to sleep properly for weeks may have option A insomnia, option B migraine, option C anemia, option D asthma. The correct answer is option B insomnia. Insomnia is a common sleep disorder marked by difficulty falling or staying asleep. Next question. Which of these is an example of positive coping? Option A alcohol use, option B talking to a friend, option C avoiding everyone, option D ignoring emotions. The correct answer is option B talking to a friend. Open communication helps release emotions and build mental strength. Next question. Which vitamin is linked to mood and brain function? Option A vitamin D, option B vitamin C, option C vitamin B12, option D vitamin A. The correct answer is option A vitamin D. Low vitamin D levels are associated with mood disorders and depression. Low vitamin D levels are associated with mood disorders and depression. What is the full form of PTSD? Option A post-therapy stress disorder, B pre-traumatic stress disorder, option C post-traumatic stress disorder, option D persistent thought stress disorder. The correct answer is post-traumatic stress disorder. PTSD is a condition triggered by experience or witnessing a traumatic event. The full form of PTSD is post-traumatic stress disorder. Which disorder is associated with mood swings and impulsive behavior? Option A bipolar disorder, option B schizophrenia, option C OCD, option D autism. The correct answer is option A bipolar disorder. Bipolar disorder alternates between depressive lows and manic highs. Bipolar disorder alternates between depressive lows and manic high. Which of the following is a symptom of schizophrenia? Option A hallucinations, option B headache, option C rash, option D fatigue. The correct answer is option A hallucination. Schizophrenia often causes seeing or hearing things that are not real. Schizophrenia often causes seeing or hearing things that are not real. Which branch of psychology studies mental illness? Option A clinical psychology, option B social psychology, option C education psychology, option D sports psychology. The correct answer is option A clinical psychology. Clinical psychology focus on diagnosing and treating mental and emotional problems. Next question. Which is a common symptom of depression? Option A increased appetite, option B persistent sadness, option C high energy, option D rapid speech. The correct answer is option B persistent sadness. Depression causes prolonged sadness, low motivation and loss of pleasure. Depression causes prolonged sadness, low motivation and loss of pleasure. The fear of open spaces is called option A claustrophobia, option B agoraphobia, option C acrophobia, option D hydrophobia. The correct answer is option B agoraphobia. Agoraphobia is the fear of being in places where escape might be difficult. Agoraphobia is the fear of being in places where escape might be difficult. Which neurotransmitter is linked to pleasure and motivation? Option A dopamine, option B serotonin, option C cortisol, option D insulin. The correct answer is option A dopamine. Dopamine helps regulate motivation, pleasure and reward pathways in the brain. The next question. Which therapy focus on understanding unconscious thoughts? Option A psychoanalysis, option B cognitive therapy, option C behavioral therapy, option D art therapy. The correct answer is option A psychoanalysis. Psychoanalysis explores unconscious conflicts that influence emotions and behavior. Psychoanalysis explores unconscious conflicts that influence emotions and behavior. What is the main goal of the mental health counseling? Option A to push unhealthy behavior, to improve emotional well-being, to reduce intelligence, to ignore feelings. The correct answer is to improve emotional well-being. Counseling supports emotional regulation and personal growth through guided conversation. Next question. Which of the following can help reduce stress? Option A deep breathing exercises, option B negative thinking, option C avoiding sleep, option D excessive caffeine. The correct answer is option A deep breathing exercises. Deep breathing calms the nervous system and lowers stress hormone levels. Deep breathing calms the nervous system and lowers stress hormone levels. The next question, what is an example of mental health stigma? Option A, treating patients equally, believing mental illness is a weakness, promoting awareness, encouraging therapy. The correct answer is option B, believing mental illness is a weakness. Stigma arises from false beliefs or discrimination towards those with mental illness. Next question. Which habit can negatively affect mental health? Option A, regular exercise. Option B, poor sleep and junk food. Option C, meditation. Option D, social interaction. The correct answer is option B, poor health and junk food. Unhealthy lifestyle choices can worsen mood and energy levels. Next question. Which mental health condition causes repetitive unwanted thoughts? Option A, OCD. Option B, depression. Option C, PTSD. Option D, bipolar disorder. The correct answer is option A, OCD. Obsessive compulsive disorder causes intrusive thoughts that leads to repetitive rituals like hand washing. Next question. What does mental resilience mean? Option A, ignoring stress. Option B, recovering from challenges quickly. Option C, avoiding emotions. Option D, always being happy. The correct answer is option B, recovering from challenges quickly. Resilience means bouncing back from difficulties through positive coping skills. Next question. Which is a healthy emotional outlet? Option A, talking to someone. Option B, suppressing feeling. Option C, overeating. Option D, isolating. The correct answer is option A, talking to someone. Sharing feelings help relieve emotional stress and promotes healing. Next question. Which of the following helps improve mental health? Option A, lack of sleep. Option B, regular exercise. Option C, alcohol consumption. Option D, overthinking. The correct answer is option B, regular exercise. Exercise increases endorphins that elevate mood and reduce anxiety. Exercise increases endorphins that elevate mood and reduce anxiety. The next question. Which part of the brain controls emotions? Option A, cerebrum. Option B, limbic system. Option C, brainstem. Option D, occipital lobe. The correct answer is option B, limbic system. The limbic system regulates emotional responses and memory formation. Next question. Psychiatric medicines mainly affect option A, the immune system. Option B, brain chemicals. Option C, skin cells. Option D, heart rate. The correct answer is option B, brain chemicals, that is neurotransmitters. Psychiatry does balance neurotransmitters like serotonin and dopamine. Next question. What is the main cause of burnout? Option A, chronic workplace stress. Option B, physical exercise. Option C, healthy relationship. Option D, rest and sleep. The correct answer is option A, chronic workplace stress. Burnout results from prolonged stress and emotional exhaustion in work environments. Next question. Which day is observed as World Mental Health Day? Option A, 10th October. Option B, 7th March. Option C, 15th April. Option D, 21st September. The correct answer is option A, 10th October. World Mental Health Day is observed globally on October 10th to raise awareness and promote education. Thank you all.